Social Planning. Part 2. A Health Sector in 5-Year Planning. 1. Progressive Health Services. Fifth Plan, 1974-78, launched the Minimum Needs Program, MNP, focusing on rural health services, expansion of primary health centers, PHCs, and immunization. Seventh Plan, 1985-90, strengthened rural health services under the National Health Policy, 1983. Emphasis on maternal and child health, MCH. Eighth Plan, 1992-97, introduced national health programs like the Reproductive and Child Health, RCH, program. Ninth Plan, 1997-2002, focused on decentralized health planning and introduction of the National Population Policy, 2000. 10th Plan, 2002-2007, launched National Rural Health Mission, NRHM, 2005, to improve rural healthcare infrastructure. 11th Plan, 2007-12, strengthened NRHM, focused on reducing infant mortality rate, IMR, and maternal mortality rate, MMR. 12th Plan, 2012-17, shifted focus to universal healthcare coverage, with increased funding for health infrastructure. B. Nutrition in 5-Year Planning. First Plan, 1951-56, emphasized nutrition programs for vulnerable groups, introduction of midday meals in schools. Second Plan, 1956-61, strengthened food distribution and focused on preventing malnutrition. Third Plan, 1961-66, expanded Integrated Child Development Services, ICDS. Fourth Plan, 1969-74, started Applied Nutrition Program, ANP, and emphasized supplementary nutrition. Fifth Plan, 1974-79, launched Integrated Child Development Services, ICDS, in 1975, which continues to be a key nutrition program. Sixth Plan, 1980-85, strengthened ICDS and special nutrition programs for children. Seventh Plan, 1985-90, National Nutrition Policy, 1993, was framed to address widespread malnutrition. Eighth Plan, 1992-97, expanded ICDS and introduced the Midday Meal Scheme, MDMS, in primary schools. Ninth Plan, 1997-2002, strengthened food security and emphasized Public Distribution System, PDS. 10th Plan, 2007-12, introduced National Food Security Act, 2013, in the later years. 11th Plan, 2012-17, focused on nutrition-based interventions through ICDS restructuring. C. Education in 5-Year Planning. First Plan, 1951-56, focused on primary education and literacy expansion. Second Plan, 1956-61, established new universities and technical education institutions, IITs, AIAMS. Fourth Plan, 1969-74, emphasized universal primary education. Fifth Plan, 1974-78, launched the Non-Formal Education Program, NFE, for dropouts. Sixth Plan, 1980-85, focused on adult literacy programs and teacher training. Seventh Plan, 1985-90, launched Operation Blackboard to improve school infrastructure. Eighth Plan, 1992-97, strengthened District Primary Education Program, DPEP. Ninth Plan, 1997-2002, promoted universal primary education under Sarva Shiksha Abhiyan, SSA. 10th Plan, 2002-2007, focused on higher education reforms and vocational training. 11th Plan, 2007-12, launched Right to Education Act, RTE, 2009, making education a fundamental right. 12th Plan, 2012-17, emphasized quality education and digital learning. D. Housing in 5-Year Planning. First Plan, 1951-56, emphasized rural housing under the Village Housing Program. Second Plan, 1956-61, established Housing and Urban Development Corporation, HUDCO, 1970. Third Plan, 1961-66, launched the Slum Clearance Program. Fourth Plan, 1969-74, introduced urban housing schemes. Fifth Plan, 1974-78, introduced Minimum Needs Program, MNP, for rural housing. Sixth Plan, 1980-85, initiated Indira Awas Yojana, IAY, 1985, for rural poor housing. Seventh Plan, 1985-90, strengthened IAY and promoted slum rehabilitation. Eighth Plan, 1992-97, focused on urban housing development through National Housing Policy. Ninth Plan, 1997-2002, expanded urban infrastructure and housing for weaker sections. 10th Plan, 2002-2007, launched Jawaharlal Nehru National Urban Renewal Mission, JNURM, 2005. 11th Plan, 2007-12, promoted affordable housing schemes. 12th Plan, 2012-17, launched Pradhan Mantri Awas Yojana, PMAY, 2015, for urban and rural housing. E. Family Planning in 5-Year Plans. First Plan, 1951-56, India became the first country to launch a national family planning program. Second Plan, 1956-61, focused on birth control methods. Third Plan, 1961-66, established family planning clinics. Fourth Plan, 1969-74, sterilization programs were introduced. Fifth Plan, 1974-78, forced sterilization drive during the emergency period. Sixth Plan, 1980-85, shifted focus to voluntary family planning. Seventh Plan, 1985-90, integrated family planning with maternal and child health services. Eighth Plan, 1992-97, launched the Target-Free Approach, 1996, shifting from coercion to voluntary participation. Ninth Plan, 1997-2002, formulated the National Population Policy, 2000, to stabilize population growth. 10th Plan, 2002-2007, expanded reproductive healthcare services. 11th Plan, 2007-12, strengthened family planning services under NRHM. 12th Plan, 2012-17, focused on delaying marriage age and promoting contraception awareness. NITI Aayog. NITI Aayog, National Institution for Transforming India, was established on January 1, 2015, replacing the Planning Commission. It serves as a policy think tank to promote sustainable and inclusive development. Need for NITI Aayog. Population growth. India's large and diverse population requires region-specific policies rather than centralized planning. Focus on healthcare, education, and employment to address demographic challenges. Economic transition. Shift from a centrally planned economy to a market-driven economy necessitated a flexible planning approach. NITI Aayog promotes sustainable economic growth and poverty reduction. Role of private sector. The private sector plays a significant role in industrialization, job creation, and innovation. NITI Aayog facilitates public-private partnerships, PPP, in development. Forces of globalization. Economic liberalization and global integration require adaptive policies to compete in international markets. NITI Aayog helps India align with global economic trends. Role of states. Strengthens cooperative federalism, giving states more autonomy in development planning. Encourages decentralized governance for effective policy implementation. Role of NITI Aayog. Uplifting the poor and marginalized. Implements welfare schemes like Aspirational Districts program to develop backward regions. Promoting inclusiveness. Focuses on gender equality, social justice, and empowerment of SC/ST communities. Rural economy and society. Encourages agriculture reforms, digital connectivity in villages, and rural entrepreneurship. Demographic dividend. Invests in skill development to utilize India's young workforce. Local participation. Involves Panchayati Raj institutions and local bodies in governance. Good governance. Introduces policy reforms for transparency and efficiency. Sustainability. Focuses on climate change, renewable energy, and environmental protection. Support for small industries. Encourages micro, small and medium enterprises, MSMEs, and startup ecosystems. Functions of NITI Aayog. Promoting cooperative and competitive federalism. Encourages states to compete and implement best practices in governance. Vision planning. Develops long-term strategic plans for national development. Decentralized planning. Encourages state and district-level development models. Providing expertise. Acts as a knowledge hub for economic and social policies. Hub of knowledge and innovation. Facilitates research and technological innovation in governance. Conflict resolution. Mediates interstate disputes related to resources and development. Harmonizer. Aligns center-state policies for national growth. Monitoring and evaluation. Assesses policy implementation and recommends necessary reforms. Capacity building. Provides training and development programs for government institutions. Social change. Meaning of social change. Social change refers to the transformation in social institutions, behaviors, and cultural norms over time. It is influenced by economic, political, technological, and cultural factors. Definitions of social change. Jones, social change is a term used to describe variations in, or modifications of, any aspect of social processes, social patterns, social interactions, or social organization. Kingsley Davis, social change is the alteration in social structure and cultural patterns through time. Morris Ginsburg, social change refers to changes in the structure and functioning of society. H. M. Johnson, social change is a process in which significant alterations occur in the structure and functioning of social systems. Characteristics of social change. Continuous process, society keeps evolving over time. Universal, occurs in all societies, but at different rates. Multifactorial, influenced by technology, economy, culture, politics, etc. Positive or negative, can lead to progress, e.g., education reforms, or problems, e.g., environmental issues. Planned or unplanned, some changes are deliberate, e.g., government policies, while others occur naturally, e.g., cultural shifts. Planning and social change. Government plays a crucial role in directing social change through planned policies, e.g., education, healthcare, urban development. NITI Aayog focuses on planned social change by ensuring inclusive growth, sustainability, and governance reforms.
Thank you so much for watching. Don't forget to like, share, and subscribe. See you in next video.